What is physician-assisted suicide? This will be a discussion about some distinctions in the debate over physician-assisted suicide, defining what it is and what it is not. And it will be a discussion from the Catholic perspective. So what are we talking about when we talk about this subject? Well, this is a practice in which a doctor prescribes a lethal medication which a patient then takes on his own or voluntarily without the help of someone else to alleviate suffering. An example would be Brittany Maynard. Now, the question is, what should we call this practice? Well, I would propose that we call it physician-assisted suicide because it is a suicide in which a physician assists. But some advocates of the practice call it medical aid in dying. I would argue that this is a bad term for the practice because it's ambiguous. The words medical aid in dying in English describe uncontroversial practices, like hospice. Hospice aids dying people medically. Who would not be opposed to aiding a dying person? On the other hand, the term medical aid in dying would equally be applicable to more controversial practices, like voluntary doctor-administered euthanasia, or even involuntary euthanasia, could be described as aiding the dying process, aiding a dying person medically. And in fact, there's evidence that even healthcare workers don't fully understand what the term means. A survey in Quebec in 2015 revealed that 60% of healthcare workers did not know that legalizing medical aid in dying would allow patients to self-administer lethal medication. This is a bad term because it is ambiguous. On the other hand, if you look at the ordinary definition of the word suicide, it is an act of taking one's own life voluntarily and intentionally. And that perfectly describes what we're talking about. There's no mention of terminal illness or not, no mention of suffering or not. It applies in all those cases. No mention of whether the family is involved or whether the decision is impulsive. Suicide just is taking one's own life. It connotes self-administration, which is exactly what we're talking about, and differentiates it from doctor-administered euthanasia, which is not self-administered. It connotes intention, because it is self-administered, and the suicide involves the intention to die. So this differentiates it from involuntary euthanasia. It also differentiates it from other practices that might hasten death as an unintended effect, like withdrawing treatment or terminal pain control. I believe we should use the term physician-assisted suicide because rational thought begins with clear and precise terminology, and we're striving for rational thought on this subject. Now, for a Catholic, one additional point is that physician-assisted suicide falls under the definition of euthanasia in Catholic moral theology. So by euthanasia is understood an action or an omission which of itself or by intention causes death in order that all suffering may in this way be eliminated. So the idea is that euthanasia just means to cause death to alleviate suffering, which is really the way we commonly use the word. In medical literature, there is a tradition of distinguishing euthanasia as doctor-administered and physician-assisted suicide as self-administered. And this can be a useful distinction, especially because assisted suicide tends to be a less controversial practice. But under the moral species of Catholic moral theology, both would be considered euthanasia because they both cause death to alleviate suffering. It doesn't matter whether it is the doctor or the patient who is acting, or whether it's an action or a refusal to act that causes death. If you're intending the death, then it is a species of euthanasia. Assisted suicide is not hospice or palliative care. Hospice and palliative care are both directed towards the alleviation of symptoms, not the end of the patient's life. It is also morally different than withdrawal of life-sustaining treatment. That's a complicated subject, and I'm going to devote a separate segment to how assisted suicide is different than withdrawing life-sustaining treatment. But it's also different than terminal pain control. And what I mean by that is basically if a person is in pain and you continue to turn up the morphine drip until the pain is controlled, in some cases, it's very rare, but in some cases, this could shorten the patient's life. I was once at a discussion of physician-assisted suicide, and a doctor presented an argument against it for 30 minutes. And a Catholic priest stood up at the end and was almost heckling him for inconsistency because he allowed terminal pain control as a moral option, but he did not allow assisted suicide as a moral option. So there is confusion about the difference, and I would just like to take a few minutes to explain that. So within the Catholic tradition, Pope St. John Paul II allowed terminal pain control. He said it is licit to relieve pain by narcotics even when the result is decreased consciousness and a shortening of life. Now there were a number of other conditions which had to be met for this to be licit, but the point is that it was or could be licit. And the reason and the difference between this and a physician-assisted suicide or other forms of euthanasia is that death is not willed or sought. There's a difference in intention. And I also included references to other church documents which address this concern and allow terminal pain control in some cases. Now, there are certain limitations. Because death is not intended in this practice, you don't use more than you need. You would use the minimum dose required to control the severe pain. You can't just give morphine to a person who's not in pain, wink, wink, and say, this isn't assisted suicide. Because not using the minimum dose required would betray that in that case, death is intended. And likewise, there should be no other less harmful treatment options. The person must be in severe pain. You wouldn't do this for a prick on the finger. There must be a serious reason to deprive the person of consciousness, mainly the severe pain, and an inability to suffer it. And there should be no other serious duties. So if a person needs to be reconciled with a family member or has some other serious duty that needs to be fulfilled before death, then it may not be legitimate to treat pain to the point of unconsciousness. But there is a difference between terminal pain control and physician-assisted suicide. And that's important to understand. And it can be some relief to us who have fear of intense suffering at the end of life, because this is a licit option that is not morally equivalent to assisted suicide. So in summary, physician-assisted suicide is the best term for the practice we're talking about because it's very clear. On the other hand, medical aid in dying is too ambiguous. Physician-assisted suicide is also a form of euthanasia as it is defined in the moral teaching of the Catholic Church. And using medications to control pain is not assisted suicide, even if it unintentionally hastens death.